watching America Trends. I'm Mary Burt Godwin, and our next guest is the founder and CEO of Dr. Tay Concierge Clinical Care and licensed psychologist. She specializes in neurodivergent affirming care for autistic children and their families, including very early diagnosis and early intervention. She has a PhD in clinical psychology and is the CEO and founder of Dr. Tay, Concierge Clinical Care. Her practice includes and integrates the whole family approach, which is a process she created utilizing evidence-informed principles. This is interesting. After seeing a gap in autism care and as a function of her own personal experience growing up with a brother who was diagnosed at 23 months of age. Welcome to America Trends, Dr. Taylor Day.
Hi, so excited to be here today. Thank you so much for having me.
Great to meet you. Thank you so much for being here. I have so many questions for you, and I want to start before we dive into the specialization in the autism world and autism care. I want to talk about, you handle children and this whole family approach, which is very timely because it's back to school. Could be stress, lots of, changes in routines. Kids and parents are coming off summer routines. So, let's talk about that a little bit and how this whole family approach works in this time of year. And actually, what is the whole family approach?
Yeah, so the whole family approach is something that I developed after really seeing a need in autism care, that we become very focused on what the autistic child needs. And that is so incredibly important. And what we know from outside of the autism field is that family therapy and supporting the entire family unit is ultimately going to support the autistic child even more. And so it's really on focusing on all members of the family to make sure that they feel seen, heard, and supported throughout the autism care process.
Okay, I love that. Now, and you can, use it for probably not just autism though, right?
Totally.
Any situation. One of my daughters was just diagnosed with ADHD, so we're kind of diving into research, diving into talking to her teachers and the studio and her sibling and, all the different ways and figuring out, oh, okay, we all need to maybe approach things a little bit differently and work together, right? Because it's all going to affect us differently. So talk to me about, first of all, I have a question for you before we dive into that, because I feel like I've been told that we're, maybe the PC term these days is to say children with autism or child with autism. But I know in reading some of this stuff, it was saying autistic child. Does it really matter, or where are we at with that?
Yeah, so it's interesting. I would say if I answered this 5 years ago, I would have been saying child with autism, where it is what's called person first language. We now as a field have shifted to identity first language, and in large part because of listening to autistic adults. What autistic adults say is that autism is part of their identity. It's not something that we're trying to get rid of. And so when we say like person with autism, it makes it sound like maybe there's a fix or a cure. But instead, it's part of their identity and understanding that their brain just thinks differently. So autistic person is what a large majority of the autistic community prefers.
Okay, I'm so glad to know that, because I do feel like it was a little bit like trying too hard to tiptoe around the subject and maybe be overly cautious with hurting people's feelings. But you're right. It's the fact of the matter. We're not saying anything negative by saying autistic. So I'm glad to know that. I think that's a really good tip. Now, you have a brother who was diagnosed at age 23 months. Is that about when diagnoses happen?
I would say more so nowadays. What we know from research is that autism diagnoses can be made reliably as young as 14 months of age. But that is not usually what's out there. Many pediatricians will talk about, you can't find a provider until age 3, 4, or sometimes school age. But just knowing that if you have concerns about your child, you can advocate for that earlier diagnosis. And so my brother is 23 now. So this diagnosis happened over 2 decades ago. And it was in huge part because of my mom's advocacy, because she knew in her gut something wasn't right.
Yeah. Moms always have that gut feeling. And I feel like I do love hearing stories, of people advocating for themselves and or their children to say, we got to push further here because something's not right. And, you know, there's a spectrum, right, obviously, and is it a, you know, you want to get the diagnosis first and then you kind of figure out the spectrum and figure out where your child sits on it?
So, as part of the diagnostic evaluation, the provider you're working with can help you understand where your child's strengths are and where they're going to need more support. And so, with it being a spectrum, what we're going to see though ultimately is that there's a lot of variability across many different areas. And so, even when we were talking about terminology earlier, like even the terminology of high and low functioning is something we phased out because what we see is that autistic children have strengths in certain areas and then just need more support in other areas. But working with your child's provider, you know, at time of diagnosis can be helpful, as well as in terms of tailoring intervention approaches too.
So when we are talking about, you know, this time of year, let's say this change in back to school, and, you know, for kids without autism and kids with, both need to be adjusting somehow to different maybe wake up times or whatever it may be, and the rigorous schedule. What are some tips that you have for families and kids to kind of make this time of year go a little bit easier on everyone?
Yeah, I mean, I think this goes for all families is as soon as possible getting back into a routine and into, you know, something that's predictable. I even recommend talking with your children about what that routine is so that they know how to predict it, they know what's coming, and I think that can be really really important. And I think for all individuals, including yourself as a parent, getting into a routine is going to help mornings feel more calm. It's also going to help afternoons feel more successful. Your child's homework is going to be able to get done, and you're going to then be able to prioritize the things that are important to your family and make sure those are fitting in as well.
And what are your thoughts on parents? I mean, I think this probably varies on the age, but parents getting involved with teachers, talking to the teachers, getting to know them, sending them an email. I know at the beginning of last year, both my daughters travel a lot for dance, so I sent emails just saying, hey, heads up, this is happening. They're very active, competitive dancers. They will be missing a little bit of school. I'm always involved. I'm here to talk to. I got some replies back and some, you know, they didn't care. But, you know, at what ages do you think it's appropriate for the parents to talk, you know, like what grade level? And do you think it even helps?
You know, I think if you have concerns, it's important to always follow your gut and intuition there, or something you feel like that is different, being able to communicate that. I do think for neurodivergent children or children with medical needs that it can be very helpful early on to communicate with your child's teacher so that, you know, ultimately you guys can collaborate together. I think that becomes important. And then for exceptions like you're talking about, I actually think that's a great idea because then, you know, at least teachers are in the loop. Even if they're not replying, they usually are reading that information. I do think there's a balance though. You know, we hear all the time how busy teachers are and, you know, how much they are already having to work outside of school hours. And so I think being mindful of, hey, how important does this feel to communicate with my child's teacher? And then as kids age, I think the more that we can empower, you know, middle schoolers and high schoolers to advocate for themselves. And what can be really helpful at home is doing role plays with them, going through it, practicing what can they say to the teacher, when can they approach the teacher. That's going to make it easier, and it's teaching important skills for later on as they move into adulthood.
It's interesting that you say that, just making me think of same going back to my own situation, is that my daughter was needing to communicate. She's like, oh, I'll just tell her or text her. And I said, actually, it is important to send it in an email so that you're not just pinging her phone at a random time of night. She can check the email when she wants. It's a little more professional. She can save it or do whatever she wants. But having those conversations with kids, because their whole life is text message, right? So I guess having those conversations, like you're saying, actually does teach them a lesson for when they get a little bit older and in that communication style. Are there things that you would want to look out for your child, making sure they're on track early on in the school year with their teachers and with learning?
Yeah, I mean, I think a lot of times we think of grades as a marker of like, is my child, on track, on progress? And I do think, grades can be abstract and they don't always indicate what is going on. So I really recommend that all parents monitor carefully their child's behavior and their child's mood. If you are seeing huge changes, that means something's going on. That you need to dig into.
Well, we got to take a break. Can you stick around for another segment?
Absolutely.
Okay, great. Because I want to talk more about mood. I deal with a lot in my household. But also your concierge therapy, how it works, how it's different than other care out there. We are talking to Dr. Taylor Day of Dr. Tay Concierge Clinical Care, and we'll be right back with more America Trends right after this.